vitamin to eliminate swelling in feet and legs. You are enjoying your day, but before going to bed, you found that your body part is swelling too much. Isn't it horrible? And swelling feet, hand, head, or fingers may put you in trouble, but why to worry about all this? We are giving you the best of best treatment as of now. So be happy, just check it out. This full video. A person may experience swollen feet for several reasons, from hot weather or pregnancy to more serious health conditions like heart disease or a blood clot. Treatment for swollen feet depends on the underlying cause. If you are troubled by the problem of pain in the legs or the problem of swelling, then there may be a deficiency of these vitamins and minerals in the body. Therefore, if you are often troubled by the pain in the legs, then know which are those vitamins or minerals which are essential for you. There may be deficiency in the body. So friends, now you got the point that what problems causing swelling. Get ready to change your swellings, cry into a happiness now, because today you won't be crying sorrow, but you will be laughing such problem arise to you because you will be going to know the perfect treatment for all this problem after watching our video. So do not skip it for a second, just have a look. If you want to hold this proverb tight in your life, then don't forget to give us your precious subscribe to our this channel before moving to our this video. And be prepared for our last points, because in the last we'll tell you that how this swelling occur to you, while you are not facing even any type of problems, guys. Friends, the problem of pain in legs often persists in the body. Generally, people think that the reason for its occurrence is tiredness. But along with tiredness, there can be other main reasons as well, such as deficiency of vitamins, minerals, and magnesium in the body. So know that if the legs are often tired, then what could be the reasons behind it? And if these symptoms appear in the body, then these symptoms can be treated. You should not ignore it. There may be deficiency of vitamin B12 in the body, which cause? If there is deficiency of vitamin B12 in the body, then its effect starts appearing in your legs. Vitamin B12 improves the blood cells, while it also prevents the deficiency of blood in the body. Puts away. If there is deficiency of it, then problem of pain in legs can occur. Hence, you must consume foods containing it. Magnesium deficiency. Magnesium is a very important mineral for our body. It helps our muscles and nerves work properly, keeps our blood sugar and blood pressure in check, and even helps build protein. But if we don't get enough magnesium, we can start to feel yucky. Some signs that you might be low on magnesium include muscle cramps and tightness, especially in your legs. You might also feel tired and weak all the time. In some cases, low magnesium can even affect your heart and make it beat irregularly. Other things you might notice include nausea, vomiting, and trouble sleeping. People with low magnesium may also be more prone to anxiety, depression, and high blood pressure. Because magnesium is important for bones too, not getting enough can make them weaker and more likely to break. There's even some research suggesting that low magnesium might be linked to migraines. If you're worried you might be deficient in magnesium, talk to your doctor. They can do a test to check your levels and recommend the best way to get more magnesium, whether through changes in your diet or by taking supplements. Iron deficiency. Talking about iron, you should consume things containing it in sufficient quantity. It is very helpful in keeping the body healthy. Talking about iron, if there is deficiency of it, then the body may have to face many problems. If there is deficiency of it in the body, then its effect is seen on your feet. Due to this, there may be pain in your legs, and there may also be difficulty in walking. Therefore, to relieve pain in legs, you can include iron-rich things in your diet. Deficiency of vitamin D. Talking about vitamin D, it is an important element of our body. Its consumption keeps the body healthy for a long time. But do you know that if its deficiency starts happening, then its symptoms can be seen in your feet? Due to its deficiency, the problem of pain in your feet may persist. Hence, you must consume things containing it. So now here, we take a look at some of the reasons why a person's feet may appear swollen, when they should talk to a doctor, and what the treatment might involve. Number 1. Edema. Edema is a condition where extra fluid builds up in your body's tissues, causing swelling. This swelling can happen anywhere, but it's most common in your legs, ankles, and feet. The main way to spot edema is swelling, but there can be other signs too. Your skin might feel tight and stretched, or it might leave a dent for a few seconds if you press on it. Doctors call this pitting edema. The swollen area might also be painful, tender, or achy. You could experience stiffness in your joints, or even gain weight quickly. In some cases, edema can cause shortness of breath if fluid builds up in your lungs, or abdominal pain if it builds up in your belly. There are many reasons why you might get edema. Some common ones include heart problems that make it hard for your heart to pump blood properly, or kidney problems that prevent your kidneys from getting rid of extra fluid. Liver disease can also cause edema, especially in the abdomen and legs. There's a condition called lymphedema that causes swelling due to problems with your lymphatic system, which is a network of vessels that drains fluid from your tissues. Pregnancy, premenstrual syndrome, PMS, and even certain medications can cause edema. Sitting or standing for too long, injuries, infections, and allergic reactions are other potential causes. The treatment for edema depends on what's causing it. In some cases, you might not need any treatment at all. But if there's an underlying medical condition, it's important to get that treated. There are things you can do to help reduce edema too, like elevating the swollen limbs, wearing compression stockings, taking medications called diuretics to get rid of extra fluid, and making lifestyle changes like reducing salt intake and exercising regularly. Number 2, foot or ankle injury. Trauma to the foot or ankle can cause swelling in this area of the body. For example, a sprained ankle, which occurs when the ligaments become overstretched, could cause the foot to swell. Treatment for this. To treat a foot or ankle injury, a person should elevate the foot when possible and try not to bear weight on the affected leg. Using an ice pack or compression bandage can help reduce swelling, and over-the-counter pain relievers can help ease discomfort. If the swelling and pain do not go away, a person might need to see their doctor to rule out more severe damage. Number 3, pregnancy. A common symptom of late pregnancy is for the feet and ankles to swell. This swelling is due to fluid retention and increased pressure on the veins. Home remedies and treatment for this. To treat swollen feet during pregnancy, women can elevate their feet where possible, wear comfortable and supportive footwear, and avoid standing for extended periods. Staying cool, avoiding salt, and increasing water intake can help reduce fluid retention. Wearing supportive clothing, such as tights or compression stockings, should also reduce discomfort and help the swelling decrease. Number 4, preeclampsia. If swelling during pregnancy comes on suddenly and is severe, it could be a sign of preeclampsia. This is a condition that can occur during pregnancy or immediately after the birth. Symptoms include protein in the urine, rapid excessive fluid retention, and high blood pressure. This is a medical emergency that usually occurs in the latter half of pregnancy and can progress to eclampsia, which is even more dangerous and constitutes a medical emergency. Signs of preeclampsia include severe swelling, headaches, dizziness, nausea and vomiting, vision changes, less frequent urination, high blood pressure, seizures. Treatment for this. If a pregnant woman experiences any of these symptoms, she should speak with her doctor or midwife straight away. Number 5, lifestyle factors. Some lifestyle factors can also lead to swollen feet. These factors include having a sedentary lifestyle, being overweight, wearing ill-fitting shoes, consuming a diet high in salt. Home remedies, exercising regularly, and maintaining a healthy weight can reduce the risk of swollen feet. Other ways to alleviate swollen feet include wearing compression socks or stockings, soaking the feet in cool water, raising the feet above the heart regularly, staying active, losing weight if overweight, eating a healthy diet and being mindful of salt intake, massaging the feet. Number 6, a side effect of medication. Taking certain medications can result in the feet swelling, especially if they cause water retention. Medications that may cause the feet to swell include Hormones, such as estrogen and testosterone calcium channel blockers, that help control blood pressure steroids, both androgenic and anabolic, and corticosteroids, antidepressants, non-steroidal anti-inflammatory drugs, medication to help manage diabetes. Anyone who thinks that their medication is causing their feet to swell should speak with a doctor who may be able to alter the dosage or prescribe a different type of medication. Number 7. Alcohol. Alcohol can cause the body to retain excess water, causing the feet to swell. If the swelling continues for more than 2 days, a person should make an appointment with their doctor. Recurrent swelling of the feet after drinking alcohol may be a sign of an underlying issue with the heart, liver, or kidneys. Home remedies. Elevating the feet above the heart, drinking plenty of water, and reducing salt intake may all help minimize swelling. Soaking the feet in cold water can also relieve symptoms. Number 8. Hot weather. During hot weather, the feet can swell trusted source because their veins expand to cool the body. This process can cause fluid to leak into the surrounding tissue. Fluid can also collect in the ankles and feet. Home remedies. Drinking plenty of water and wearing well-fitting, comfortable shoes that allow some ventilation can help prevent the feet from swelling in warm weather. Compression stockings may also help. Number 9. Infection. An infection can cause swelling in the feet and ankles. People with diabetes have an increased risk of infection affecting their feet, so they should remain vigilant for any changes to this part of the body, such as blisters and sores appearing. Treatment: a doctor will typically prescribe antibiotics to treat infections. It can also be a serious condition that requires emergency treatment to prevent more serious infection of the blood. Number 10. Venous insufficiency. Venous insufficiency occurs when venous blood does not return to the heart and pools in the legs. This is due to damaged valves causing blood to leak down the vessels. This can cause fluid retention in the lower legs, particularly around the feet and ankles. Signs of venous insufficiency includes achy legs, skin changes, skin ulcers, infection treatment. A person experiencing any signs of venous insufficiency should make an appointment with their doctor as soon as possible. To treat venous insufficiency, a doctor may recommend making some lifestyle changes, such as taking up exercise to help keep the blood pumping around the body efficiently. Compression stockings and medication to prevent blood clots can also help. In some cases, a doctor may suggest surgery to try to repair the damaged valves. Number 11. Blood clot. Blood clots occur when the blood fails to flow around the body correctly, causing platelets to stick together. If blood clots develop in the leg veins, they may prevent the blood from moving back to the heart. This can cause the ankles and feet to swell. Deep vein thrombosis occurs when blood clots form deep in the legs. This is a serious condition that can cause a blockage in the major leg veins. In some cases, the clots may break loose and move to the heart or lungs. Signs of this includes swelling in one leg, pain or discomfort in the leg, low-grade fever, color changes in the leg. Treatment for this. If a person notices any signs of this, then they should seek urgent medical attention. A doctor may prescribe blood-thinning medication to treat blood clots. People can help prevent blood clots by wearing tights, compression stockings, or clothing that is loose-fitting around the ankles. Other prevention methods include keeping active and reducing salt intake. It is also best to avoid standing or sitting still, especially with crossed legs for extended periods. Number 12. Lymphedema. The lymphatic system helps the body get rid of unwanted substances such as bacteria and toxins. Lymphedema occurs when lymphatic fluid gathers in the tissues as a result of problems with the lymph vessels. If the lymph vessels are damaged or absent, lymphatic fluid can build up and lead to infection, slow wound healing, and even deformity. People who undergo radiation therapy or lymph node removal have a higher risk of lymphedema. Anyone who has undergone cancer treatment and experiences swelling should contact their doctor immediately. As well as swelling of the feet, signs of lymphedema includes recurrent infections, impaired motion, aching, a feeling of tightness or heaviness, thickening of the skin. Treatment for this treatment options for lymphedema include exercises and targeted massage, which can both help drain the excess fluid. Wearing bandages or compression garments may also be beneficial. Number 13. Heart disease. Swelling of the feet could be a sign of heart disease or heart failure. If the heart is damaged, it cannot pump blood to the heart efficiently. Right-sided heart failure can cause the body to retain salt and water, resulting in swollen feet. As well as swelling of the legs, ankles, and feet, symptoms of heart failure includes shortness of breath, particularly when exercising or lying down, rapid heartbeat, weakness, fatigue, coughing or wheezing, white or pink, blood-tinged phlegm, abdominal swelling, rapid weight gain from fluid retention, loss of appetite, nausea or vomiting difficulty, concentrating, or confusion. Treatment for this. If a person experiences any of the above symptoms, they should seek immediate medical attention. Treatment options for heart failure include trusted source medications, medical devices to help support the heart, and surgery. Number 14. Kidney disease. People with poorly functioning kidneys may be unable to flush out fluid, which can build up in the body. Kidney disease may not present any symptoms until it is severe and the kidneys are beginning to fail. Signs and symptoms of kidney failure includes less frequent urination, shortness of breath, drowsiness or fatigue, pain or pressure in the chest, seizures, nausea, confusion. Coma treatment for this trusted source for kidney disease include medication, a low-protein diet, and supplements of vitamin D and calcium. The treatment options for kidney failure include dialysis or a kidney transplant. Number 15. Liver disease. Liver disease can inhibit the production of albumin. Albumin is a protein that helps stop the blood leaking from blood vessels. A lack of albumin means that the blood may leak, causing fluid to pool in the legs and feet, which can result in swelling. Symptoms of liver disease includes jaundice, in which the skin and eyes turn yellow, dark urine, bruising easily, loss of appetite, skin itching, lack of energy, nausea or vomiting, tender, swollen abdomen, pale, bloody, or tar-colored stools. Treatment for this to treat liver disease. A doctor may prescribe medication. They may also suggest lifestyle changes, such as losing weight or reducing alcohol intake. In more severe cases of liver disease, surgery may be necessary. We hope that you liked this information greatly, and let us remind you that our whole information, including in every videos, was finest. And if you want all that great information, then quickly subscribe this channel, like the video, and don't forget to share it with your family, friends, and loving ones dear.
Did you know that blood clots are one of the top causes of death around the world, leading to over 100,000 deaths each year? It's a startling number. If you're curious like I am, you might be asking, are there natural ways to fight these dangerous clots? Stay with us, because today, we're going to explore 6 powerful oils that might help save lives. Hello! Today we're going to talk about something that affects many people, blood clots. Just hearing the words blood clots can be alarming because they can lead to serious problems like heart attacks and strokes. But don't worry, there are natural ways to lower your risk, and that's what we're going to discuss today. Blood clots can suddenly form in your veins and arteries, and treating them usually means taking medications that can have their own side effects. This is why it's good to consider other options. There are 6 powerful oils that might help prevent these clots. These oils have been used in traditional medicine for many years and are now being recognized for their natural health benefits. Stick with us as we explore each of these oils and how they could truly improve your health. You won't want to miss what's coming up next. Let's talk about why blood clots are such a serious issue. While a blood clot might seem harmless, it can actually lead to dangerous conditions like heart attacks and strokes. Imagine a clot forming in your veins or arteries without you realizing it. That's a scary thought, right? Unfortunately, this happens to many people. These clots can travel through your bloodstream and block important pathways, cutting off oxygen and nutrients to vital parts of your body, which can have devastating effects. Typically, blood clots are treated with medications, but these treatments aren't perfect. They can cause side effects like excessive bleeding, nausea, and even long-term health issues. Because of this, not everyone wants to depend on these medications, especially if they're worried about the side effects. That's why more people are turning to natural alternatives to support their health. Essential oils have been used in traditional medicine for centuries. These natural remedies are known for being gentle yet effective. Oils like ginger, cinnamon, and clove have been studied for their ability to improve circulation, reduce inflammation, and help prevent the formation of dangerous clots. But how do you know which oil is best for you? And how can you easily add them to your daily routine? If you're interested in safer, natural ways to support your heart and circulatory health, essential oils could be the solution. So keep watching as we explore the 6 best oils that can help you fight blood clots naturally and effectively. We'll start with one you probably already have in your kitchen: ginger oil. First on our list is ginger oil, a real champion when it comes to improving circulation and reducing inflammation. Ginger has been a staple in traditional medicine for ages, especially in Asian cultures. The secret to ginger oil's effectiveness is its strong anti-inflammatory and antioxidant properties. These can help lower the risk of blood clots, which often form due to inflammation and poor blood flow. A key part of ginger oil is gingerol, a compound known for its ability to enhance blood flow and stop platelets from sticking together. Platelets are tiny blood cells that clump to form clots. While clotting is needed to stop bleeding when you're hurt, too much platelet clumping can lead to dangerous clots that block blood vessels. Studies show that ginger oil can reduce platelet clumping, which means it may help stop clots from forming in the first place. Plus, ginger oil is a natural blood thinner, making it easier for your blood to flow smoothly through your veins and arteries. Here's something to think about. Just imagine adding a few drops of ginger oil to your daily routine and possibly lowering your risk of serious clots. But don't go anywhere yet. The next oil on our list has its own set of impressive benefits. Next up is cinnamon oil, another essential oil with strong health benefits, especially for your circulatory system. Cinnamon is well known for its rich flavor and smell, but it also has medicinal properties that make it great for heart health. Cinnamon oil contains cinnamaldehyde, a compound that gives cinnamon its unique scent and taste. More importantly, cinnamaldehyde has anticoagulant effects, meaning it helps prevent your blood from clotting too much. This is crucial because too much clotting can cause blockages in your blood vessels, raising the risk of heart attacks and strokes. But that's not all. Cinnamon oil is also packed with antioxidants that help fight inflammation throughout your body. By reducing inflammation, cinnamon oil can help prevent the conditions that lead to blood clots. In fact, research suggests that cinnamon oil may help lower blood pressure, reduce cholesterol levels, and improve overall heart health. Here's a thought. Adding cinnamon oil to your routine could be as easy as using it in a diffuser or mixing it with a carrier oil for a soothing massage. But before you try it, stay tuned. The next oil is one you definitely don't want to miss. Now let's talk about clove oil. Clove is another spice that's been used for centuries in traditional medicine, particularly in Ayurvedic and Chinese practices. The active ingredient in clove oil is eugenol, a compound with powerful antioxidant and anti-inflammatory effects. Eugenol is what makes clove oil especially good at improving blood flow and thinning the blood. When your blood is too thick, it can lead to clots that block blood flow to important organs. By thinning the blood, clove oil helps ensure your blood flows smoothly, reducing the risk of clots. But that's not all. Clove oil also has pain-relieving properties, which means it can help ease pain and inflammation in the body. This is especially helpful for people with conditions like arthritis or chronic pain, where inflammation is a major problem. So here's a quick question for you. What if something as simple as using clove oil in a warm bath or applying it to your skin could help protect you from dangerous blood clots? Stick around, because the next oil we're about to discuss could be just as important. Next up is lemon oil. This oil is not only refreshing and uplifting, but also offers many health benefits, particularly for your heart. Lemon oil is rich in vitamin C and other antioxidants, making it great for detoxifying your body and supporting overall health. One of the key benefits of lemon oil is its ability to improve circulation. By helping blood flow better, lemon oil ensures that oxygen and nutrients are delivered efficiently to your organs and tissues, reducing the chance of clots forming in your blood vessels. Additionally, lemon oil has anti-inflammatory properties, which can help reduce the inflammation that often leads to clots. It also supports liver function, helping your body get rid of toxins that could cause health problems. Here's something to remember. Just a few drops of lemon oil in your water or tea can not only brighten your day, but might also help protect your heart. But don't go away. The next oil is a must-know for anyone worried about blood clots. Next on our list is rosemary oil. This oil is often used to stimulate circulation and improve blood flow, making it a great choice for anyone looking to reduce their risk of blood clots. Rosemary oil contains rosmarinic acid, a compound known for its anti-inflammatory and antioxidant properties. By reducing inflammation in blood vessels, rosemary oil helps prevent the conditions that lead to clot formation. Additionally, rosemary oil has been shown to improve blood flow by dilating the blood vessels, allowing blood to move more freely through your body. But that's not all. Rosemary oil also has a calming effect on the nervous system, which can help reduce stress and lower blood pressure. Since high blood pressure is a risk factor for blood clots, using rosemary oil as part of your relaxation routine could be a simple yet effective way to support your heart health. Here's something to consider. Adding rosemary oil to your diffuser or using it in a massage could be a relaxing and health-boosting habit. But don't go anywhere yet. The final oil on our list is one you definitely don't want to miss. Last but not least, let's talk about peppermint oil. This oil is famous for its cooling and refreshing properties, but it also offers significant benefits for your circulatory system. Peppermint oil contains menthol, a compound that helps relax the muscles and improve blood flow. When your muscles are tense, they can squeeze your blood vessels, making it harder for blood to flow freely. By relaxing the muscles, peppermint oil helps ensure that your blood circulates smoothly, reducing the risk of clot formation. Additionally, peppermint oil has pain-relieving and anti-inflammatory properties, making it a great choice for easing pain and reducing inflammation in the body. This is particularly helpful for people who suffer from conditions like muscle cramps or chronic pain, where poor circulation and inflammation are common issues. Here's something to think about. What if using peppermint oil in a foot soak or adding it to your daily routine could help keep your blood flowing smoothly and protect you from dangerous clots? Now that we've covered all 6 oils, let's recap why they're so important for your health. Why these oils matter. As we've seen, each of these oils, ginger, cinnamon, clove, lemon, rosemary, and peppermint, offers unique benefits that can help support your circulatory system and reduce the risk of blood clots. Whether it's by improving blood flow, reducing inflammation, or thinning the blood, these oils provide natural solutions that can complement your overall health routine. What's great about these oils is that they're easy to incorporate into your daily life. Whether you prefer using them in a diffuser, applying them to your skin, or even adding them to your food, there are plenty of ways to enjoy their benefits. But remember, while these oils can be a powerful addition to your health routine, they're not a substitute for professional medical advice. Always check with a healthcare provider before making any significant changes to your health routine. Let's focus on the highlight of today's oils. Ginger oil. If there's one oil you should think about adding to your health routine, it's ginger oil. Why? Because it offers many health benefits, especially for your blood circulation and lowering the risk of blood clots. Ginger oil isn't just for adding flavor to your food, it's a strong, natural remedy that can be really good for your health. Studies show that ginger oil helps improve circulation and reduces inflammation, which can be important for preventing blood clots. When your blood flows well, you lower the risk of clots, which is key to avoiding serious issues like heart attacks and strokes. But there's more. Ginger oil can also stop platelets from sticking together too much. Platelets are tiny cells in your blood that help with clotting. If they stick together too much, they can create clots that cause serious health problems. By keeping these platelets from clumping too much, ginger oil helps maintain healthy blood flow. Using ginger oil is quite simple. You can add it to your daily routine in a few different ways. For example, you might use it in your cooking. A few drops in your favorite dishes can boost flavor and provide health benefits. If cooking isn't your thing, Try adding ginger oil to your smoothies. It's a great way to get this oil into your diet without changing your meal plans. For a more direct approach, you could use ginger oil in massage therapy. Mix a few drops with a carrier oil, like coconut or olive oil, and apply it to your skin. This can help with circulation and relax your muscles. It's a great way to support your heart health while also enjoying a soothing experience. Ginger oil is also useful in aromatherapy. Adding a few drops to a diffuser can fill your space with a nice, spicy aroma and offer its benefits. This is a good way to relax after a long day while giving your body a boost. Adding ginger oil to your wellness routine is easy. It's affordable and easy to find, making it a practical choice for many people. Plus, you don't need a lot to start seeing benefits. Just a little can make a big difference. Using ginger oil daily could be a simple step towards better heart health. Think about it. You're not just adding flavor to your food or enjoying a relaxing massage. You're also taking a proactive step to reduce the risk of dangerous blood clots. It's an easy addition with potentially big health benefits. Whether you use ginger oil in cooking, skincare, or aromatherapy, it offers many benefits that can help you maintain healthy blood flow and lower clot risks. Just imagine having a natural ally that supports your cardiovascular health and helps your body run smoothly. Remember, making small changes over time can add up. By adding ginger oil to your routine, you're making a simple yet effective choice for better health. With all its benefits, ginger oil is a great option for anyone wanting to support their body naturally. So next time you think about your health, consider trying ginger oil. It could be a game changer, offering a natural and effective way to support your circulation and overall well-being. This version keeps the essence of the original while making the language more accessible. If I had to pick one oil that stands out, it would be ginger oil. Why? Because of its wide range of benefits. Not only does it improve circulation, but it also has anti-inflammatory properties that can help prevent future clots. Plus, it's incredibly versatile. You can use it in cooking, add it to your smoothies, or even incorporate it into a massage oil. Adding ginger oil to your daily routine could be a simple yet powerful way to support your health. Imagine that, not just enjoying its flavor, but also taking a significant step towards better heart health. Let's go over what we've talked about today. Blood clots are a big health problem and can cause serious issues like heart attacks and strokes. It's really important to find ways to lower the risk of blood clots. We've looked at 6 different oils that might help with this: ginger oil, cinnamon oil, clove oil, lemon oil, rosemary oil, and peppermint oil. Each oil has its own special benefits for your heart and blood flow. Ginger oil is great because it reduces inflammation and can help blood flow better. Cinnamon oil helps keep blood flowing smoothly because it prevents clotting. Clove oil has been used for a long time and can thin the blood and improve circulation. Lemon oil can help detoxify the body and lower clot risk because it has lots of vitamin C, which is good for the heart. Rosemary oil improves blood flow and reduces inflammation, while peppermint oil helps with circulation and muscle tension, both important for good blood flow. Using these oils can be an easy way to support your health. You can use them in aromatherapy, add them to food, or use them in massages. But remember, these oils shouldn't replace professional medical advice. Always talk to your doctor before making big changes to your health routine. By adding these oils to your health plan, you can better manage your risk of blood clots and support your overall health. These natural remedies can work alongside traditional treatments and offer a gentler way to stay healthy. I'd love to hear from you. Have you tried any of these oils? Have you noticed any benefits or have any tips on using them? Leave a comment below and share your thoughts and experiences. Your feedback helps others and builds our community where we can all learn from each other. If you found this video useful, don't forget to hit the subscribe button. By subscribing, you'll get updates on our latest videos about natural remedies, health tips, and more. We're always looking for new ways to help you live a healthier life and bring you valuable information. Also, check out my other videos where we explore more natural remedies and health tips. There's a lot more to discover, and I'm excited to share more with you. Thanks so much for watching and being part of our community. Your support means a lot to me. See you in the next video.
Did you know that heart attacks can strike without warning? In fact, 1 in 5 heart attacks is silent with no obvious symptoms, but there are warning signs that can appear as early as a month before. Don't wait until it's too late. Heart attacks are one of the leading causes of death worldwide, and yet many people don't recognize the signs until it's too late. The good news is that your body often sends signals before a heart attack happens, sometimes even a month in advance. In today's video, we're going to talk about 8 early warning signs of a heart attack that could save your life or the life of someone you love. Being informed and vigilant can be the difference between life and death. Heart attacks have become increasingly common, affecting millions of people each year. One of the biggest challenges we face is that many people don't know the early signs to watch for. They assume a heart attack will come with sharp chest pain and an immediate collapse. While that can happen, often there are subtler signs leading up to the event. The problem is, these signs are often mistaken for something else: stress, indigestion, fatigue, or just aging. This lack of awareness can delay critical medical intervention. Today, we'll break down the 8 key signs you need to be aware of so that you or someone you care about doesn't fall victim to this silent killer. Each of these signs can be subtle or easy to dismiss, but taken together or even individually, they are red flags that something serious might be happening within your heart. So, I request you to watch the video till the end and like the video, and do not forget to subscribe to the channel. So let's start. Number 1, fatigue. Fatigue is often dismissed as a mere result of overwork or stress, but it can be a significant and early warning sign of a potential heart attack. Unlike the usual tiredness we experience after a long day, the fatigue associated with heart problems is often persistent and profound. It's not just about feeling a bit worn out after a busy schedule. It's a deep-seated exhaustion that doesn't seem to improve with rest or sleep. This type of fatigue can manifest in several ways, from a general sense of lethargy and weakness to a marked decrease in your ability to perform routine tasks. For individuals experiencing heart problems, this persistent tiredness is often due to the heart's reduced ability to pump blood efficiently. When the heart struggles to circulate blood properly, it results in decreased oxygen delivery to the body's tissues and organs. This lack of adequate oxygen can lead to an overall feeling of exhaustion because your body has to work harder to perform its basic functions. Additionally, this form of fatigue is often accompanied by a notable lack of energy, making even simple tasks like climbing stairs or walking a short distance seem overwhelmingly challenging. For some, this exhaustion may appear suddenly and without any apparent reason, or it may develop gradually over time, becoming more pronounced as days go by. It's important to note that fatigue associated with heart problems isn't limited to just physical exhaustion. It can also include mental and emotional fatigue. Individuals might find themselves feeling unusually drained, irritable, or depressed, which can further exacerbate their overall sense of unwellness. This type of fatigue may be subtle but persistent, and it can significantly affect one's quality of life. Often, people experiencing such fatigue might attribute it to stress, poor sleep, or age-related decline, overlooking it as a potential sign of a more serious issue. However, if you're experiencing a level of tiredness that interferes with your daily life and doesn't seem to improve with adequate rest, it's crucial to consider that it could be an early warning sign of heart trouble. Recognizing and addressing this symptom early on can be vital for timely intervention and treatment, potentially preventing a serious heart event from occurring. Number 2, shortness of breath. Shortness of breath, medically known as dyspnea, is a crucial symptom that can indicate potential heart problems, especially when it occurs in the context of other warning signs. This sensation, often described as a feeling of suffocation or an inability to get enough air, is not just uncomfortable, but also a significant red flag that your heart may be struggling. When your heart is not functioning optimally, it can affect your body's ability to efficiently circulate blood and oxygen. This inefficiency often manifests as shortness of breath. The reason behind this is that the heart's decreased ability to pump blood effectively leads to reduced oxygen delivery to the tissues, causing the body to compensate by increasing the breathing rate in an attempt to get more oxygen into the bloodstream. This can become particularly noticeable during physical exertion, but it can also occur at rest or during activities that previously didn't cause any issues. For instance, you might find yourself out of breath after climbing a few flights of stairs or even performing routine activities like walking or carrying groceries, which previously did not cause any trouble. In some cases, individuals experience shortness of breath while lying flat, a condition known as orthopnea, which can be especially alarming and is often associated with heart failure. This symptom can also be accompanied by a feeling of chest tightness or pressure, adding to the distress. It's essential to recognize that shortness of breath can sometimes be mistaken for less serious conditions such as asthma, anxiety, or even a common cold. However, if this symptom is persistent, worsening, or occurring without a clear cause, it should not be ignored. The presence of shortness of breath alongside other symptoms such as chest discomfort, fatigue, or swelling in the legs can further heighten the concern for potential heart issues. In such cases, seeking medical evaluation promptly is critical. Early diagnosis and treatment can significantly improve outcomes and potentially prevent a more severe cardiac event. It's also worth noting that shortness of breath can sometimes be a result of an underlying heart condition that has been developing over time. So even if it appears mild initially, it's vital to monitor and address it with a healthcare provider. Number 3, chest discomfort, not always pain. When it comes to heart attacks, many people envision a sudden, sharp pain in the chest as the primary symptom. However, the reality is often quite different. In many cases, the discomfort associated with an impending heart attack can be much more subtle and might not even be perceived as pain. This discomfort is frequently described as a sensation of tightness, pressure, fullness, or squeezing in the chest. It might feel like a heavy weight resting on the chest or an uncomfortable pressure, rather than the acute pain that one might expect. This type of discomfort can come and go, varying in intensity, and it may not always be severe enough to warrant immediate medical attention in a person's mind. Often, individuals experiencing this symptom might mistake it for heartburn, indigestion, or even stress, particularly if it occurs after physical exertion or during periods of emotional strain. For some, the discomfort may be mild and persistent, felt more like an annoying pressure that just doesn't seem to go away. It can occur intermittently or persist over a period of days or weeks. It's essential to recognize that this chest discomfort is not always localized to the center of the chest. It can radiate to other areas such as the shoulders, arms, neck, back, or even the jaw. Women in particular might experience less typical presentations of this symptom, which might include a general sense of discomfort rather than a specific location of pain. This makes it all the more important to be aware of and to take any persistent or unexplained chest discomfort seriously. The key takeaway is that chest discomfort, even if it doesn't feel like classic chest pain, should be treated with caution. It's a significant warning sign that could indicate reduced blood flow to the heart or other cardiac issues. Number 4, sweating. Sweating, particularly sudden and unexplained cold sweat, can be a significant indicator of a potential heart attack, especially when it occurs in conjunction with other symptoms. Unlike the normal sweating you might experience from physical exertion or a hot environment, this type of sweat is often characterized by its unexpected onset and cold, clammy nature. This cold sweat, or diaphoresis, is a physiological response that occurs when the body is under significant stress or strain, which in the context of a heart attack is due to the heart's increased demand for oxygen and the body's attempt to manage the ensuing crisis. When a heart attack is imminent or occurring, the heart muscle struggles to receive sufficient blood flow, leading to a condition called ischemia. This ischemia triggers the body's fight or flight response, a stress reaction that activates the autonomic nervous system. This system controls involuntary bodily functions, including sweating. The cold sweat you might experience is a result of this stress response where the body, despite being under duress, tries to cool itself down in response to the internal turmoil. It's a paradoxical reaction. While sweating is typically associated with exertion or heat during a heart attack, it can be a sign of severe distress and a malfunctioning of the body's normal processes. In many cases, this type of sweating is not isolated but occurs alongside other signs of a heart attack, such as chest pain, shortness of breath, or nausea. The cold sweat can be alarming because it often appears without any apparent cause, such as a sudden drop in temperature or a stressful situation. For many people, the appearance of this cold sweat might be so sudden and intense that it feels like their body is breaking into a sweat, despite them not being physically active or overheated. This can create a sense of urgency and panic, which is a direct response to the body's internal stress signals. Number 5, dizziness or lightheadedness. Feeling dizzy, faint, or lightheaded for no apparent reason can also be an early warning sign of a heart attack. This symptom occurs when your heart is not pumping enough blood to your brain, depriving it of the oxygen it needs to function properly. You may feel unsteady on your feet, like the room is spinning, or you might even pass out briefly. These sensations are alarming and should not be ignored, especially if they happen frequently or without a clear cause, such as dehydration or standing up too quickly. Dizziness in combination with shortness of breath or chest discomfort could mean your heart is failing to pump blood efficiently. Number 6, nausea or stomach pain. Many people don't associate nausea or stomach pain with heart problems, but they can be early signs of a heart attack, particularly in women. You might experience unexplained nausea, a feeling of indigestion, or even a burning sensation in the upper abdomen. Some may dismiss this as something they ate, but when paired with other symptoms, it could be a warning sign that your heart isn't functioning properly. This is because when the heart struggles to pump blood, it can affect other organs, including your stomach. It's also possible to experience vomiting or intense stomach discomfort, which can be easily mistaken for a gastrointestinal issue when in fact it's heart-related. Number 7, pain in other areas: arms, back, neck, jaw. One of the more perplexing and often overlooked signs of an impending heart attack is pain that radiates to areas beyond the chest, such as the arms, back, neck, or jaw. This symptom can be particularly insidious because it often mimics common ailments or discomforts that people might attribute to less serious conditions. The key to understanding this sign lies in recognizing that the heart is a central organ connected to various nerve pathways, and when it's under distress, the pain can be referred to other parts of the body. For instance, pain radiating down the left arm is commonly associated with heart attacks due to the shared nerve pathways between the heart and the arm. This pain might begin as a dull ache or a feeling of heaviness and can intensify, spreading to the shoulder or upper arm. Similarly, discomfort in the back, particularly between the shoulder blades or in the lower back, can be a sign of a heart issue. This type of pain often feels like a persistent ache or pressure rather than a sharp, localized pain. The connection between neck pain and heart attacks can be equally confusing. People might experience a discomfort or tightness in the neck, which can be mistaken for a muscular problem or even tension. This type of pain might be accompanied by a feeling of pressure or a sense of constriction. Additionally, pain in the jaw, particularly on the left side, is another warning sign. This discomfort can feel like a toothache or soreness in the jaw, often radiating up to the ear or down to the neck, and is frequently misinterpreted as dental problems or a minor muscle strain. The challenge with these symptoms is that they can vary widely in intensity and nature, sometimes appearing intermittently or in conjunction with other symptoms like fatigue or shortness of breath. It's crucial to understand that these pains, especially when they occur without an obvious cause or are persistent, could indicate a heart attack, particularly if they are accompanied by other signs such as chest discomfort or shortness of breath. Recognizing these early symptoms and seeking prompt medical attention can significantly impact the outcome of a potential heart attack. Awareness of how these pains present and their potential link to heart health can help individuals act quickly, potentially preventing a serious cardiac event. Number 8, irregular heartbeats. Your heart's rhythm is a key indicator of its health. Occasional skipped beats or brief palpitations may not be a cause for concern, especially if they happen infrequently. However, if you notice persistent or increasingly frequent episodes of irregular heartbeats, such as a rapid or fluttering sensation in your chest, it could signal that your heart is struggling to maintain a regular rhythm. These irregularities could be due to poor blood flow to the heart or even a blockage in the coronary arteries. Among the myriad symptoms that could indicate an impending heart attack, the combination of chest discomfort, shortness of breath, and sweating stands out as particularly critical and alarming. This trio of symptoms can be a powerful indicator that your heart is in severe distress and that immediate medical intervention is required. Chest discomfort that is persistent or comes and goes, particularly when accompanied by other symptoms, is a key red flag. This discomfort may not always manifest as intense pain. It can be a sensation of pressure, squeezing, or tightness that feels like a heavy weight pressing on your chest. The presence of shortness of breath, especially if it occurs during light activities or even at rest, signals that your heart is struggling to pump enough oxygen-rich blood throughout your body. When these symptoms are coupled with sudden, unexplained cold sweating, an indicator that your body is under significant stress, the situation becomes even more urgent. Cold sweat is a physiological response to a critical condition, often resulting from your body's effort to compensate for inadequate blood flow and oxygen reaching vital organs. This combination of symptoms is not merely uncomfortable, but is a clear signal from your body that it is under severe strain. If you or someone you know experiences this trio of symptoms simultaneously, it's crucial to seek emergency medical help without delay. These signs are often indicative of an impending heart attack and require immediate attention to prevent potentially fatal outcomes. Every second matters in such scenarios, and timely intervention can make a significant difference in survival and recovery. Ignoring these symptoms or attributing them to less serious conditions could lead to devastating consequences. If you found this video on the early signs of a heart attack useful, I urge you to take a moment to share your thoughts and experiences in the comment section below. Your stories could provide valuable insights and support to others who might be facing similar symptoms or concerns. Did you or someone close to you experience any of the signs we discussed? How did you or they respond? And what was the outcome? Your experiences can be incredibly enlightening and may help someone recognize and act on their own symptoms before it's too late. Additionally, if you're committed to staying informed about heart health and other critical wellness topics, I encourage you to subscribe to our channel. By subscribing, you'll gain access to a wealth of information designed to help you live a healthier, longer life. We regularly update our content with the latest research, tips, and advice on a variety of health issues, from recognizing symptoms of serious conditions like heart attacks to everyday wellness practices that can enhance your quality of life. Moreover, sharing this video with friends and family is a powerful way to spread awareness about these important warning signs. You never know who might benefit from knowing what to look for or learning about the steps they can take to protect their health. It's not just about informing ourselves, but about creating a community of well-informed individuals who can support each other in making healthier choices. If you have specific questions about heart health or other related topics, feel free to leave those in the comments as well. We're here to help, and we'll do our best to provide you with the most accurate and helpful information. Engaging with our content can also give you access to answers from health professionals and experts who can offer additional guidance. Remember, taking proactive steps to monitor and improve your heart health is one of the most impactful things you can do for your overall well-being. By staying informed and vigilant, you're not only protecting yourself, but also setting a positive example for those around you. Heart disease is a serious issue, but With the right knowledge and resources, it's something we can all work to prevent. Lastly, don't forget to explore our other videos on related topics. We have content covering various aspects of health and wellness, including tips on maintaining a balanced diet, understanding symptoms of other critical conditions, and adopting lifestyle changes that can benefit your overall health. Watching these videos can provide you with a comprehensive understanding of how to care for your body and make informed decisions about your health. Thank you for watching and for being proactive about your health. Together, we can make a significant difference in our lives and the lives of those we care about. Subscribe, share, and stay engaged for more valuable health insights and tips.
Have you been trying medication after medication or using endless creams and treatments, but still can't find relief from that nagging joint pain? You're not alone in this struggle. Joint pain is something many people experience, especially as they get older. It can range from mild discomfort to severe pain that makes day-to-day activities hard to enjoy. Sure, some aches can be eased with simple remedies, but for a lot of people, the pain just keeps coming back. What if I told you there might be a better answer? One that's simple, natural, and way more sustainable than constantly reaching for those pills. Today, we're diving into the world of plants and herbs, specifically 7 of the most powerful ones that can work wonders on your joints. These aren't just old wives' tales either. They're backed by science and proven to reduce pain and inflammation. And trust me, the 5th herb we talk about will blow your mind with how powerful it is. Stick around, and as a bonus, we'll also share some key habits that could help protect your joints and keep you feeling great for the long haul. It's time to say goodbye to the meds and that frustrating pain once and for all. Our joints are like the hidden hinges that keep our bodies moving smoothly. They're the connectors between our bones, making everything possible, from bending and walking to turning your head. Think of it like a door that swings open and closed without a problem. That's how our joints allow us to move effortlessly. But just like a door hinge can get stiff or rusty over time, our joints can start to wear out too. This leads to pain and inflammation, especially as we age, or if we overuse them or develop conditions like arthritis. Joint pain is a serious issue that can limit our ability to move freely and lower our overall quality of life. While many people rely on painkillers or anti-inflammatory meds to find relief, these options come with risks, like unwanted side effects, and usually they only provide a temporary solution. The great news is that nature offers some highly effective alternatives. There are herbs out there with impressive anti-inflammatory and pain-relieving qualities, and they can be a real game changer for managing joint pain in a more natural and sustainable way. In this video, we're going to take a closer look at 7 specific herbs that are known for their ability to reduce pain and inflammation at the source. They don't just mask the symptoms, they help tackle the root cause of your joint discomfort. And don't forget that 5th herb might already be sitting in your kitchen, waiting to surprise you with how powerful it can be. Herb number 1, ginger. Ginger is a powerful herb that can help relieve joint pain. It's more than just a spice you use in cooking. Ginger has been valued for centuries in traditional medicine, especially in practices like Ayurveda and traditional Chinese medicine, because of its ability to reduce inflammation and pain. Modern scientific research backs up these old beliefs, showing that ginger is effective at lowering pain and swelling, particularly for people dealing with arthritis, rheumatism, and muscle aches. What makes ginger work so well are its special natural compounds, mainly gingerols and shogals. These compounds have strong anti-inflammatory effects that help stop the body from producing substances that cause inflammation. For instance, a study published in the journal Osteoarthritis and Cartilage revealed that ginger extracts significantly ease pain and improve mobility in patients with osteoarthritis. Additionally, ginger contains proteolytic enzymes that help break down proteins involved in the body's inflammatory responses, which boosts its healing properties even more. Using ginger in your daily diet is easy and can be done in several ways. One popular method is to make ginger tea, which allows you to take advantage of its health benefits. To prepare it, take half a ginger root, either fresh or dried, and 2 cups of water. First, peel and slice the ginger into pieces about the size of your fingers. Then, add the ginger to the water in a pot and bring it to a boil. Let it boil for about 5 minutes, then take it off the heat and let it steep for another 5 minutes. After that, strain the tea before drinking it. For the best health benefits, it's recommended to drink it without adding any sweeteners. To get the most out of ginger, aim to drink 1 to 2 cups of ginger tea each day. Not only can it help ease joint pain, but it also aids digestion and promotes overall health. While ginger is generally safe for most people, there are some important things to keep in mind. If you're taking medications for high blood pressure or blood thinners, ginger could increase the risk of bleeding, so it's best to use it with caution. Pregnant or breastfeeding women should talk to a healthcare provider before adding ginger to their routine, especially if they are receiving any medical treatments. Remember, moderation is key. Consuming too much ginger can lead to digestive issues like heartburn or diarrhea. Herb number 2. Rosemary. Our second herb to help with joint pain is rosemary, a fragrant plant often used in cooking. But rosemary is more than just a tasty addition to meals. It has a long history of being used for medicinal purposes. People have traditionally valued rosemary for its anti-inflammatory, antioxidant, and pain-relieving qualities. Recent scientific studies back up many of these traditional uses, showing that rosemary can effectively help treat different inflammatory conditions, like arthritis and joint pain. The healing properties of rosemary come from its mix of bioactive compounds, which include rosmarinic acid, ursolic acid, and essential oils like borneol and camphor. These compounds work together to reduce inflammation and ease pain. Research published in the Journal of Medicinal Food has shown that rosemary extract can slow down the production of pro-inflammatory cytokines, which helps lower inflammation and related pain in people with osteoarthritis and rheumatoid arthritis. Additionally, rosemary's antioxidant abilities are vital in protecting joint tissues from oxidative stress, a major factor in joint diseases. The phenolic acids and flavonoids found in rosemary help fight off free radicals, which supports overall joint health and mobility. There are many ways to include rosemary in your daily routine for relief from joint pain. One simple and effective method is to use rosemary oil for a topical application. You can mix a few drops of rosemary essential oil with a carrier oil, like coconut or almond oil. The carrier oil dilutes the essential oil, making it safe to apply to the skin. Gently massage this mixture onto the joints that are hurting. This massage not only helps reduce pain, but also boosts blood circulation in the area, enhancing the benefits even more. In cooking, you can add rosemary to various dishes, such as roasted vegetables, meats, and soups. This not only gives them a unique flavor, but also provides health benefits at the same time. While rosemary is generally safe for most people, there are a few precautions to keep in mind. Concentrated rosemary oil can sometimes cause skin irritation, redness, or dermatitis, so it's a good idea to do a patch test before using it widely. Herb number 3, Boswellia. Our third herb that helps with joint pain is Boswellia, which is also called Indian frankincense. This amazing plant has been used in traditional medicine for thousands of years, especially in Ayurvedic practices, because of its strong anti-inflammatory effects. Boswellia comes from the resin of the Boswellia serrata tree, which grows in India, the Middle East, and North Africa. Its long history in herbal medicine has caught the attention of modern researchers, leading to many studies looking into how well it works for joint problems. How it works. The active compounds in Boswellia, mainly boswellic acids, are what make it so effective. These acids have strong anti-inflammatory properties because they block the production of leukotrienes, which are substances in the body that cause joint pain and swelling. A study published in BMC Complementary Medicine and Therapies showed that Boswellia extract significantly reduced pain and improved function in patients with osteoarthritis after just a few weeks of treatment. Additionally, Boswellia helps improve joint movement and flexibility by protecting cartilage and stopping it from breaking down. Research suggests that boswellic acids may even help produce hyaluronic acid, a key component of synovial fluid that keeps joints lubricated, which boosts overall joint function. How to use Boswellia. You can find Boswellia in various forms, like capsules, tablets, and topical ointments. If you want to enjoy its benefits, here are some ways to use it. Follow the manufacturer's recommended dosage, which is usually between 300 to 500 mmol, taken 2 to 3 times a day. It's best to take boswellia with meals to help your body absorb it better. Boswellia extract is also available in creams and ointments that are meant for relieving joint pain. You can apply the product to the area that hurts and gently massage it in to feel its anti-inflammatory effects. If you like a more traditional method, you can make boswellia resin into a tea or infusion. To prepare it, steep a small amount of boswellia resin in hot water for about 10 minutes, then strain it and enjoy. Precautions. While boswellia is generally safe for most people, there are some precautions to keep in mind. A few individuals may experience mild side effects, such as stomach discomfort, nausea, or diarrhea. It's important to talk to a healthcare professional before starting boswellia, especially if you are pregnant, breastfeeding, or taking other medications, as boswellia can interact with certain drugs. Additionally, people with a history of allergies to frankincense or similar substances should be cautious and might want to do an allergy test before using boswellia products. Herb number 4, white willow. Next up is white willow, which scientists call Salix alba. This amazing herb has been used for hundreds of years as a natural remedy for pain and inflammation, especially for people with rheumatic diseases. The key ingredient in white willow is salicin, a natural compound that's similar to aspirin. Long before modern aspirin was created, people used the bark of the white willow tree to help reduce fever and relieve pain. Often called natural aspirin, white willow is a favorite among those who prefer a more holistic approach to pain relief. It's particularly helpful for individuals dealing with joint pain and arthritis, thanks to its pain-relieving and anti-inflammatory properties. How it works. The pain-relieving effects of white willow mainly come from salicin. After you take it, salicin is converted into salicylic acid in your body. This acid functions much like aspirin by blocking the production of cyclooxygenase, a COX enzymes. These enzymes are responsible for making prostaglandins, which are substances in your body that promote inflammation, pain, and fever. Research shows that salicin can greatly lessen pain and inflammation from conditions like osteoarthritis and rheumatoid arthritis. A study in the Journal of Rheumatology revealed that people who took white willow saw a significant drop in their pain levels and better joint function compared to those who received a placebo. How to use white willow. You can find white willow in various forms, such as teas, capsules, and tinctures. Here's how to add it to your routine. To make a calming white willow tea, take 25 grams of dried bark for every liter of water. Bring the water to a simmer for about 5 minutes, then cover it and let it steep for another 10 to 15 minutes. If you like, you can sweeten your tea with honey or agave syrup. Drinking 1 to 3 cups of this tea each day can help relieve joint pain naturally. If you prefer capsules, follow the dosage instructions on the product label. Typical doses range from 120 to 240 mg, taken 2 to 3 times a day, depending on how severe your symptoms are. Precautions. While white willow is generally safe for most people, it's wise to be aware of potential side effects. Some individuals may have stomach issues, like upset stomach or nausea. Since it works similarly to aspirin, those who are allergic to salicylates or who take blood-thinning medications should avoid white willow to avoid any negative interactions. Herb number 5, turmeric. Now let's talk about our 5th herb, turmeric. This plant is often considered one of the most powerful and helpful for our health. Turmeric, which is scientifically called curcuma longa, is a flowering plant from the ginger family. The bright yellow spice we get from its root has been a key part of traditional medicine, especially in Ayurveda and Chinese medicine, for many years. Lately, it has become very popular in the West because of its strong anti-inflammatory and antioxidant properties. The main active ingredient in turmeric is curcumin, which is responsible for a lot of its health benefits. Curcumin is well known for its ability to influence inflammatory processes in the body, making it a vital resource for people dealing with joint pain and various inflammatory issues. When it comes to how curcumin works, its anti-inflammatory effects come mainly from its ability to block certain molecules that contribute to inflammation. Studies show that curcumin can lower the levels of pro-inflammatory cytokines, like interleukin-1, IL-1, and tumor necrosis factor alpha, TNF-A. These molecules tend to be higher in conditions such as osteoarthritis and rheumatoid arthritis, which lead to joint pain and swelling. New research has also pointed out that curcumin can stop the activity of nuclear factor kappa B, NFKB, a protein complex that controls the expression of various genes involved in inflammation. By targeting these inflammatory pathways, curcumin can help reduce pain and improve how well joints work, much like over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, but with fewer side effects. Adding turmeric to your diet is easy and can be done in many ways. One popular option is golden milk, a soothing drink made by mixing 1 teaspoon of turmeric powder with warm milk, either dairy or a plant-based alternative, along with a pinch of black pepper to help your body absorb it better and sweetener to taste. Drinking this daily can help lessen inflammation and boost your overall health. You can also sprinkle turmeric into a variety of dishes, such as soups, stews, curries, and stir-fries, to not only enhance the flavor, but also provide health benefits. Its bright color and earthy taste can really enhance many meals. If you're looking for a stronger dose, turmeric supplements are available in different forms, like capsules and extracts. A common suggestion is to take between 500 to 2,000 milliliters of curcumin daily, split into 2 or 3 doses. Always remember to follow the instructions on the package and check with a healthcare provider if you're thinking about taking supplements. While turmeric is generally safe for most people, there are a few things to keep in mind. Taking high doses of turmeric can lead to stomach problems, such as nausea or diarrhea, especially when using supplements. It's a good idea to start with a smaller dose to see how your body reacts. Additionally, turmeric might interact with certain medications, particularly blood thinners, diabetes medications, and proton pump inhibitors. So anyone taking these medications should talk to their healthcare provider before adding high doses of turmeric to their routine. Final conclusion. As we conclude our journey into the 5 powerful herbs that support joint health, ginger, rosemary, boswellia, white willow, and turmeric, it's important to understand how these natural remedies work together. Each herb plays a specific role in reducing inflammation, relieving pain, and supporting overall joint health. When combined, they create a comprehensive approach to managing joint discomfort, especially for those dealing with conditions like arthritis and osteoarthritis. In addition to using these herbs, there are some extra tips to help you maintain healthy joints. Start by eating a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Foods that are high in omega-3 fatty acids, such as fatty fish like salmon, mackerel, and sardines, as well as flax seeds, can help lower inflammation in your body. Leafy greens, berries, and nuts are also great choices because they are packed with antioxidants, which support overall health. Staying well hydrated is another key factor for joint health. Drinking enough water helps lubricate your joints, making movement smoother and less painful. Aim to drink at least 8 to 10 glasses of water each day, but adjust this based on how active you are and the climate you live in. Getting regular exercise is essential too. Low-impact activities like swimming, cycling, and yoga can strengthen the muscles around your joints and improve your flexibility. Try to get at least 150 minutes of moderate aerobic exercise each week, along with muscle-strengthening workouts twice a week. Maintaining a healthy weight is crucial since excess weight can put extra pressure on weight-bearing joints like the knees and hips. Even a small weight loss can make a big difference in reducing joint pain and improving your ability to move. If you need help, consider working with a healthcare professional to create a weight management plan that works for you. Managing stress is also important because chronic stress can increase inflammation in the body. Consider incorporating stress-reducing practices into your daily life, such as mindfulness, meditation, or deep breathing exercises. These techniques can help lower cortisol levels and support your overall well-being. If you have ongoing joint pain, consulting a physical therapist can be beneficial. They can provide personalized exercises and techniques to improve your joint function and lessen pain. Physical therapy can also help you learn proper body mechanics and posture, which can prevent additional strain on your joints. To wrap it all up, focusing on joint health through natural remedies like ginger, rosemary, boswellia, white willow, and turmeric, along with healthy lifestyle choices, can significantly enhance your quality of life. By taking a holistic approach to your health, You empower yourself to manage joint discomfort and lead an active, fulfilling life. Thank you for being part of this informative session. I hope you feel motivated to add these powerful herbs and tips into your routine for better joint health. If you found this information helpful, please share it with others who might benefit and consider subscribing for more insights on health and wellness. Together, we can create a community that focuses on natural healing and vibrant living.
And baking soda internally is very alkaline, so it can actually reduce stomach acid and interfere a little bit with digestion.
Meet Dr. Barbara O'Neill, a well-known naturopath, health educator, and author with expertise in natural healing. If you've ever had a glass of baking soda water or carbonated water, this information is crucial for you. Even though these drinks may seem harmless, just one glass could cause reactions in your body that might surprise you. While baking soda is often praised for treating heartburn and boosting exercise performance, and soda water is linked to better digestion, there are potential hidden risks you should be aware of. Baking soda water, known for its alkaline properties, is sometimes considered a miracle remedy. However, if not used properly, it can pose serious health risks. On the other hand, soda water, which is made by adding carbon dioxide to water, can help with digestion and is a sugar-free alternative to soft drinks. But drinking too much soda water, especially those with added sodium or flavorings, may lead to bloating and raise concerns about high sodium intake. In this video, we will dive into the benefits of both baking soda water and carbonated water, and we'll also point out the crucial mistakes you should avoid to protect your health. By the end of this video, you'll know how to use these simple household remedies safely, ensuring that you can enjoy their benefits without putting your well-being in danger. Stay with us as we guide you through the proper ways to use these remedies for a healthier lifestyle. Let's start with benefit number 6, eases muscle soreness and speeds recovery. If you've ever experienced soreness after a tough workout or any intense physical activity, you know how hard it can be to move the next day. Baking soda water can help ease that muscle soreness and speed up recovery. But how does it do this? Baking soda, or sodium bicarbonate, is alkaline and helps neutralize the buildup of lactic acid in your muscles. When you engage in strenuous activities, your muscles produce lactic acid, which causes that burning feeling during exercise. By drinking baking soda water, you can reduce this acid buildup, helping your muscles recover faster. Studies have shown that athletes who drink baking soda before or after exercise feel less muscle pain and fatigue. This makes it a great natural remedy for reducing soreness and improving your performance in sports or daily activities. While baking soda can be effective, it's important to use it in moderation. Taking too much can cause stomach issues like nausea, bloating, and even diarrhea. Stick to small amounts for the best result. Benefit 5, promotes better kidney health. Your kidneys are crucial for filtering out toxins and waste from your body. For those at risk of kidney stones or with chronic kidney disease, baking soda water can help support healthy kidney function. Baking soda helps by balancing the acid levels in your body. When your body becomes too acidic, it puts extra strain on your kidneys. Over time, this can worsen kidney problems. Research has shown that drinking baking soda water can help reduce the acid levels in your blood, easing the workload on your kidneys and potentially slowing the progression of kidney disease. Some doctors even recommend bicarbonate therapy for patients with advanced kidney conditions. Benefit 4, alleviates heartburn and indigestion. One of the most common uses of baking soda water is for relieving heartburn and indigestion. If you've ever felt that burning sensation in your chest after eating a big or acidic meal, you know how uncomfortable it can be. This is known as acid reflux, where stomach acid flows back into the esophagus. Since baking soda is alkaline, it neutralizes excess stomach acid, giving quick relief from heartburn. It works similarly to over-the-counter antacids by balancing the pH in your stomach. Many people rely on this remedy because it's fast, affordable, and doesn't come with the side effects of some medications. To use baking soda for heartburn, dissolve half a teaspoon of it in a glass of water and drink it slowly when you start feeling heartburn. The relief is often immediate. However, here's a big warning. While baking soda water can provide temporary relief, Overuse can make things worse. Too much can cause your body to become too alkaline, leading to a condition called alkalosis. This can result in symptoms like muscle twitches, nausea, vomiting, and even breathing issues. It's also not a long-term solution for chronic heartburn. Use it occasionally when needed. Baking soda water can be really helpful for your muscles. It works by neutralizing lactic acid, which is what often makes your muscles feel sore after a workout. By doing this, it can speed up your recovery and help you feel better faster. Additionally, baking soda water helps to balance the levels of acid in your body. This can ease the strain on your kidneys and support their overall function, making them work more efficiently. Another benefit of baking soda water is its ability to quickly relieve stomach issues. It neutralizes stomach acid, which can help with heartburn and indigestion, providing you with some much-needed relief. Medical applications of baking soda. Now that we've talked about some everyday uses of baking soda water, let's look at its more significant medical applications. These uses go beyond the basics and can have a big impact on your health. We'll explore how baking soda helps with balancing your body's pH levels and how it might help with serious health issues. The pH balance of your body is important for your overall health. Many people don't realize how crucial it is to keep this balance right to prevent chronic diseases and stay healthy. But what is pH and how does baking soda help? pH stands for potential of hydrogen and measures how acidic or alkaline something is on a scale from 0 to 14, with 7 being neutral. Your blood is slightly alkaline, with a pH between 7.35 and 7.45. Keeping this balance is very important. If your body becomes too acidic, a condition called acidosis, it can cause problems like inflammation, poor digestion, and even serious issues such as heart disease, kidney problems, or osteoporosis. Baking soda water can help balance your body's pH levels because baking soda is alkaline. It helps neutralize excess acidity in your body. Whether you're dealing with acidic foods, high stress, or other factors that make your body too acidic, baking soda water can help restore balance. When you drink baking soda, it reacts with acids in your body to form water and neutral salts, which helps lower the overall acid level. This supports your body's natural ability to keep proper pH levels and helps your organs work better. Scientific studies support this benefit. Some research has shown that bicarbonate, the key ingredient in baking soda, can help increase the pH of acidic blood in patients with metabolic acidosis, a condition often related to kidney disease or other chronic illnesses. Keeping a balanced pH level helps prevent damage to your cells, tissues, and organs. When your body is in acidosis, it makes your organs work harder to fix the balance, which can lead to inflammation, lower immunity, and other chronic health issues. Drinking baking soda water regularly can help your body maintain this important balance and avoid these problems. Benefit 2, helps with urinary tract infections, UTIs, and supports bladder health. Urinary tract infections, UTIs, are a common issue, especially for women, but anyone can get them. If you've had a UTI, you know how painful and uncomfortable it can be. Symptoms like burning during urination, frequent urges to urinate, and pelvic pain can make life very unpleasant. While antibiotics are usually used to treat UTIs, baking soda water can offer a natural way to ease symptoms and help prevent future infections. So how does baking soda help with UTIs? It's due to its alkalizing properties. UTIs are often caused by bacteria that thrive in an acidic environment. Drinking baking soda water can help neutralize the acidity in your urine, making it harder for the bacteria to grow and cause infection. When you drink baking soda water, it raises the pH level of your urine, making it less acidic. Since bacteria responsible for UTIs prefer acidic environments, this alkaline shift makes it harder for them to survive and spread. A UTI can also cause bladder irritation, leading to frequent urination. Baking soda can help soothe the bladder lining, reducing irritation and inflammation, and easing the painful symptoms associated with UTIs. Drinking more fluids is generally recommended for UTIs because it helps flush bacteria from the urinary tract. By combining baking soda with water, you not only stay hydrated but also make your urine more alkaline, which is more effective at preventing bacterial growth. If you notice early signs of a UTI, you can mix half a teaspoon of baking soda in a glass of water and drink it on an empty stomach once a day. Do this for no more than a week. Don't rely only on baking soda water for treatment. If your symptoms persist or worsen, you should consult a healthcare professional immediately. While baking soda can help with UTI symptoms, it's not a cure. It's important to get proper medical treatment if you suspect a UTI, especially if you have symptoms like fever, chills, or blood in your urine, which could indicate a more serious infection needing antibiotics. Another related benefit is improving overall bladder health. By keeping your urine less acidic, you lower the risk of bladder irritation, infections, and even kidney stones. For those prone to frequent UTIs or other urinary issues, this can be very helpful. Benefit 1. Everyday health uses of baking soda. You might be surprised to find out how a simple and inexpensive ingredient like baking soda can have a big impact on your digestive system, providing relief from common issues like acid reflux, indigestion, and more. Digestive problems are something many people experience regularly, affecting millions each day. Issues such as occasional heartburn or chronic indigestion can be quite uncomfortable and disruptive. Baking soda water offers a natural and effective way to tackle many of these digestive issues. Acid reflux happens when stomach acid flows back into the esophagus, creating a burning sensation in the chest and throat, commonly known as heartburn. This can be triggered by various factors, including certain foods, stress, or underlying health conditions. Baking soda water can provide quick relief from these symptoms due to its alkaline nature. Baking soda is a base, so when you mix it with water and drink it, it reacts with the excess stomach acid to neutralize it. This helps reduce the burning sensation associated with heartburn and makes you feel more comfortable. By neutralizing the acid, baking soda helps balance the pH levels in your stomach, which can lower the chances of acid reflux happening in the first place. To use this remedy, mix half a teaspoon of baking soda in a glass of water and drink it. This mixture can provide fast relief from heartburn or acid reflux symptoms. It's important to wait a few hours before using it again and not to exceed more than 7 doses per day. If you have chronic acid reflux, it's best to consult with a healthcare provider instead of relying only on this remedy. Indigestion, also known as dyspepsia, can cause discomfort in the stomach or upper abdomen, including symptoms like bloating, nausea, and a feeling of fullness. Bloating, in particular, can be uncomfortable and sometimes painful. Baking soda water can help with these symptoms in several ways. Indigestion often leads to the production of excess stomach gas. By neutralizing stomach acid, baking soda helps reduce the gas that causes bloating and discomfort. When the pH balance in your stomach is off, it can impair digestion and result in feelings of fullness and discomfort. Baking soda helps balance this pH, supporting more effective digestion and reducing these symptoms. For indigestion, mix 1 teaspoon of baking soda in a glass of water and drink it. This can help soothe your stomach and relieve discomfort. For bloating, a similar solution can help reduce the gas causing the bloating. However, if you experience persistent bloating, it may indicate an underlying issue that needs medical attention. Good digestive health is important for overall well-being. Digestive problems can lead to various issues, including nutrient deficiencies and increased susceptibility to infections. Baking soda water can be a helpful addition to your routine for promoting a healthy digestive system. Regularly drinking baking soda water can help maintain balanced stomach acid levels, which is crucial for healthy digestion. This balance supports nutrient absorption and prevents discomfort from digestive disturbances. Some believe that baking soda water can also assist in detoxifying the digestive system, helping to flush out toxins and maintain a healthy balance of stomach acid and enzymes. This can contribute to overall digestive health and well-being. Drinking a small amount of baking soda water daily, such as once a day, can help keep your digestive system functioning smoothly. Just be careful not to overuse it, as excessive use can lead to alkalosis or other issues. 4. Important considerations and precautions. While baking soda water offers many benefits for digestive health, it's important to use it correctly and be aware of potential risks. Although baking soda can provide relief from digestive discomfort, it's not a cure-all. Persistent or severe symptoms should be evaluated by a healthcare professional to rule out serious conditions like ulcers, GERD, or other gastrointestinal disorders. Baking soda contains sodium, which can affect blood pressure and overall health if consumed in excess. 5. How to incorporate baking soda water into your routine. If you're interested in adding baking soda water to your routine for digestive health, here are some tips. Start with a small amount to see how your body reacts. You can gradually increase the amount if needed, but always stay within the recommended limits. Pay attention to how your body responds to baking soda water. If you notice any adverse effects, stop using it and consult with a healthcare professional. For best results, combine baking soda water with a balanced diet rich in fruits, vegetables, and whole grains. Risks and mistakes when using baking soda. We've explored the many benefits of baking soda for various health aspects, but it's just as important to understand the potential risks and common mistakes associated with its use. Knowing these can help you use baking soda safely and effectively, avoiding any unintended side effects. 1. Risks of overuse. A major concern with baking soda is the risk of using too much. Even though it's a simple substance, consuming excessive amounts can lead to serious health issues. When you take in too much baking soda, you might develop a condition called alkalosis, where your blood becomes too alkaline. This can cause symptoms like muscle twitching, hand tremors, and nausea. In severe cases, it can lead to more serious problems like seizures or heart issues. Baking soda is also high in sodium, and consuming too much can disrupt your body's electrolyte balance. This can lead to swelling, high blood pressure, and dehydration. Additionally, overuse of baking soda can cause digestive problems like gas, bloating, and upset stomach. The high sodium content can increase stomach acid production, leading to worsening symptoms if not used correctly. 2. Common mistakes. When using baking soda, even if you use baking soda with good intentions, mistakes in its application can lead to ineffective or harmful results. One common mistake is using too much baking soda, whether it's in a drink, a paste, or a bath. Exceeding the recommended amount can lead to the problems mentioned earlier. Always measure carefully and follow the guidelines. For instance, when making a baking soda water solution, stick to the recommended half teaspoon per glass of water. Another mistake is overlooking the sodium content in baking soda, especially if you have high blood pressure or heart conditions. People often ignore this aspect, which can lead to adverse effects due to excessive sodium intake. 3. Special considerations. Certain groups need to be especially cautious when using baking soda. Its sodium content can impact kidney function, so if you have kidney problems or are on a low-sodium diet, avoid using baking soda without consulting your doctor. Pregnant and nursing women should also be cautious about using baking soda regularly, as the effects on fetal development and lactation are not fully understood. Always consult with a healthcare provider before using baking soda in these situations. 4. Using baking soda in combination with other remedies. When combining baking soda with other home remedies or health treatments, be aware of potential interactions and cumulative effects. Baking soda is often mixed with acidic substances like lemon juice or vinegar for various purposes. While this can be effective, the reaction can cause a sudden release of carbon dioxide, which might lead to bloating or discomfort if ingested in large amounts. Use such mixtures cautiously and in moderation. If you're taking medications, especially antacids or those affecting stomach acid, combining them with baking soda might alter their effectiveness. 5. Summary of key points. Excessive use of baking soda can lead to alkalosis, electrolyte imbalance, and digestive discomfort. Stick to the recommended dosages to avoid these issues. Common mistakes include incorrect dosage, ignoring sodium content, using baking soda as a substitute for medical treatment, and not considering medication interactions. Now that we've covered the many benefits, medical uses, everyday applications, and possible risks of baking soda, it's time to focus on how to choose the right baking soda and summarize the main points. This will help you make informed decisions for your health and wellness journey. When buying baking soda, it's important to select a high-quality product. Not all baking sodas are the same, and making the right choice can enhance your health benefits while minimizing risks. For health-related purposes, you should buy pure baking soda with no added chemicals or preservatives. The label should state that it contains 100% sodium bicarbonate. Avoid products labeled as baking powder or those with extra ingredients, as they are not suitable for health uses. Opt for food-grade baking soda, which is safe for consumption and tested for safety. This type is usually found in grocery stores and health food shops and is specifically meant for baking and other culinary uses. It ensures safety for internal use. Baking soda does have a shelf life and can lose its effectiveness over time. Always check the expiration date on the package before buying. Using expired baking soda can lead to reduced effectiveness and may not provide the intended benefits. If you plan to use baking soda frequently, buying in bulk can be cost-effective, but ensure you store it in an airtight container to keep it fresh and potent. Avoid moisture exposure, which can degrade its quality. Choose reputable brands known for their quality and safety. Brands with a strong reputation and positive customer reviews are generally safer. Steer clear of dubious sources or unverified brands that might not follow quality standards. Proper storage is key to maintaining baking soda's effectiveness. Store it in a cool, dry place away from moisture, as moisture can cause clumping and reduce its efficacy. An airtight container is ideal to keep it dry and fresh. Baking soda can absorb odors from its surroundings, so keep it away from strong-smelling substances to preserve its freshness. Ensure the container is sealed tightly to prevent exposure to air and moisture, which helps maintain the baking soda's potency over time. As we wrap up our discussion on baking soda water, let's recap the essential points. Baking soda offers many benefits, such as digestive relief, improved oral hygiene, and versatile household uses. It can neutralize stomach acid, enhance toothpaste, and more. Its medical uses include relieving indigestion, balancing pH levels, and providing temporary relief for certain health conditions. However, it should be used carefully and not as a substitute for professional medical advice. In everyday life, baking soda is a valuable tool for personal care and household maintenance. Whether refreshing your breath or deodorizing your home, its versatility is impressive. Be aware of potential risks, such as overuse, incorrect dosage, and interactions with medications. Understanding these risks and avoiding common mistakes will help you use baking soda safely. Incorporating baking soda into your health routine can be highly beneficial, but it's essential to use it wisely and responsibly. By choosing high-quality baking soda, following recommended dosages, and being aware of potential risks, you can enjoy its benefits while minimizing any adverse effects. Remember, baking soda is a powerful yet simple remedy, and like any tool in your health toolkit, it's most effective when used correctly. If you're unsure, consult with a healthcare provider to ensure baking soda is suitable for your needs. Thank you for joining us on this comprehensive look at baking soda water. If you found this information useful, don't forget to like the video and subscribe to our channel for more health tips and remedies. Share your experiences in the comments. How has baking soda helped you? We'd love to hear your stories. Stay tuned for our upcoming videos where we explore more natural remedies and wellness tips. Remember, managing your health is a journey, and we're here to support you every step of the way. Until next time, take care and stay healthy. This concludes our detailed look at baking soda water. With the right knowledge and precautions, you can safely and effectively use this versatile substance. Thanks for watching, and we look forward to bringing you more valuable insights in our future videos.